My name is Alice Rothschild. I'm on the steering committee of the Jewish Voice for Peace Health Advisory Council. And I just want to welcome everyone to our 10th Jewish Voice for Peace Health and Human Rights webinar, which we are very, very happy to be co-hosting with some founding members of the Palestine Global Mental Health Network. The webinar is titled Resisting Occupation and Pandemic, Mental Health in Palestine Now. Lami Houri, who is a psychotherapist working in New York, is going to be the moderator. And we're going to have three speakers, Sama Jabber, who's a psychiatrist practicing in East Jerusalem and the West Bank, Yasser Abujana, who's the Director General at Gaza Community Mental Health Program in Gaza, and Manal Abu Haq, who's a clinical social worker and psychoanalytic psychotherapist working in Ramla in historic Palestine. As Sam mentioned, after the talk, there will be a Q&A, which will be done through the chat box. And if those of you have escaped Zoom meetings, the chat box is located by hovering at the base of your screen and typing in your question. And please keep them short and well-directed. And then Lam will be in charge of directing the panelists to answer questions. After the webinar, we will be sending everyone a survey. So please fill out the survey so we can figure out how to do better. And just to let you know, the next Jewish Voice for Peace webinar will be in September with Fadi Karan, who's a senior campaigner at Avaz and a popular struggle community organizer, and also a leader in wind and solar energy in Palestine. So Lama, it's all yours. You've got to unmute yourself, Lama. Lama, unmute yourself.
Yes. I unmuted myself. It just told me that. So there. So thank you, Alice, very much, and thanks to JVP and the Health Advisory Council for giving us this platform and for the truly incredible work you do. As Alice said, the meeting is on resisting occupation and pandemic. And the three presenters and myself are among the founders of the Palestine Global Mental Health Network. The network was established a little over a year ago with the purpose of promoting the ideals of mental well-being, liberation, dignity, and social justice for all peoples and societies, with particular attention to Palestine. And I must say, for me, the three presenters are among the best Palestinian clinicians and activists I know. Our first presenter is Dr. Samah Jabber, who, as Alice mentioned, is a psychiatrist practicing in the public and private sectors in East Jerusalem and West Bank. She is at present the head of the mental health unit within the Palestinian Ministry of Health. She is also a teacher and an educator and a faculty in several Palestinian universities and George Washington University, where she is currently an associate clinical professor. And Samah, the floor is yours.
Thank you. Thank you for this kind introduction. And thanks for organizing this event. It's so good to see you and to respond to your interest in Palestine by trying to share our part of this global experience. Allow me to share a few slides with you if you can enable me. I'm trying to share slides on my screen. If it's not possible, I can manage. Tell me if it's possible. Please, Alice.
Let me, I'm gonna try to make that possible. Give me 1 second.
Okay.
Tell me if you can now.
I think I can, yes. So I'm going to share with you a few things about our response, mainly in the West Bank, to this unusual experience. Let me see. Can you see my screen now?
Yes.
Okay. So this slide summarizes how Palestine has been touched by this pandemic. We see at the beginning, on the 5th of March, on the 6th of March, in fact, Palestine announced an emergency state. and there was a complete lockdown that ended at the Eid holiday by the 26th of May. And we realized right from the beginning that our preparation at a tertiary health level is very limited. In the West Bank, for example, we had only 80 ventilators in governmental hospitals and 120 in non-governmental centers, medical centers. So the immediate response of the Palestinian government was to impose a lockdown. And we see that just after the lockdown, there was an important escalation in cases. But the overall picture is that Palestine is less touched than other countries, even within the region, and much less than the cases and the health situation in Israeli areas. And there are probably certain characteristics that explain this observation. It's a young population, but the big risk is that it's a young population with important prevalence of chronic diseases, including diabetes, hypertension, and mental health issues. And maybe also because we don't test enough, that the numbers are low. And among the ones who are affected, we see that most of the people are asymptomatic cases, and the number of deaths is limited. 5 persons lost their life due to this pandemic. What's interesting in this experience is that we are facing this situation that is exposing the fragmentation of the Palestinian community and, of course, the fragility of the health system. And the response was different in each geographical area. For example, for Jerusalemites and 48 Palestinians, they are mainly served by the Israeli health system, and there has been important inequalities in health provision. The 48 Palestinians are 20% of the population. There is an 80% Jewish majority. And but in their representation in the health sector as workers, their representation is higher than that. Nevertheless, there was a delay in producing Arabic material. There was a delay in creating the testing centers for Jerusalemites and Palestinians from 48. There was not a representation in the Emergency Health Committee. And this reaction exposes the long-term discrimination against this population, that is a minority population within the Israeli health system. In the West Bank and Gaza, the situation reflects the different levels of political oppression faced by these two areas. The tough measures regarding closure means economic devastation, but we were obliged to do it because of the lack of preparation at the tertiary level. It was heavy for the people, and of course, there will be an important mental health impact because of that closure and the economic devastation, especially because this is followed by new restrictions, economic restrictions related to the annexation plan, and now governmental employees have not been getting their salaries for more than 60 days almost. Gaza is even less prepared than the West Bank, and my colleague will be speaking about it. I don't want to forget the Palestinians in refugee camps outside Palestine. This cartoon was made by a Lebanese cartoonist and published in a mainstream Lebanese journal. And it creates a resemblance between the virus and the pandemic and old conflicts in Lebanon in 75. And I'm bringing this cartoon to discussion not only because it has something to do with the rest of Palestinians outside Palestine, but also a pandemic of this kind for a fragmented population can, and because it is related, the infection is related to somehow to the behavior of people, it's easy to stigmatize and to discriminate and to blame. So this is an example of this further blaming and stigmatization that can take place in these difficult times. Other examples of the exacerbation of difficulties we in the West Bank and in Jerusalem, the health system has already been affected because of the cuts of funds that took place by the American administration over the past few years. Laborers and prisoners are already at disadvantage in our political system. Laborers have, they get paid on daily basis. If they don't work, there is no good social system that will recompensate them. So it was very difficult for them to stop working. And so at the beginning, the orders were that those who go and work in Israeli areas, they should not come back soon. They should not come back on daily basis. Those who couldn't abide to the restrictions were blamed and stigmatized. On certain cases, we saw some laborers who were suspected to be carriers of the virus or symptomatic of COVID. They were dragged, literally dragged and dumped at Palestinian checkpoints by their employers, Israeli employers. So the impact was severe for laborers. And the same for Palestinian prisoners who were cut off from their families. Already they are in prisons away from their hometowns, and the families need to obtain special permission to go and visit them. So the pandemic created extra difficulties for these people who are already at risk. This
I
is,
make it you.
No, that's you.
tell me if I need to stop.
You is you talking.
I hear an echo.
I don't know, but if it's gonna be out loud, there's no need for headphones.
Sorry,
Can
I'm
I
trying to
continue?
fix it.
It's just it's a troll, so you.
I can continue. I have a few more minutes.
Yes, please carry on. I'm sorry.
So this is an example of of course, home demolition continued, detention, imprisonment continued, but this time the soldiers are wearing the protective equipment to do their usual activities in the West Bank. One last theme that I want to touch upon is Israel's false generosity. The United Nations has praised Israel for its excellent cooperation with the Palestinian Authority and for their generosity. Actually, they transferred $25 million to the PA, but media doesn't tell us where does this money come from. It's from previously withheld tax money that belongs to the Palestinian Authority. They sent some medical equipment to the West Bank and Gaza, including 20 ventilators to augment the 80 that exist there, and some testing kits and masks. And they were commended and complimented for their action. They also allowed WHO and Qatari money to arrive to Gaza and to the West Bank. And they had their arrangements with Arab Emirates to bring another kind of false charity to Palestinians. I just want to remind you that providing health and adequate health to a colonized people is something that is guaranteed by the Geneva Convention. Israel is responsible for the health of Palestinians by law, by ethics, and also by the usual reasoning. A pandemic cannot touch, like Israel it's in the interest of Israel to make sure that the Palestinians don't get the infection. So I don't think Israel should be complimented or commended about giving the little help they provided to Palestinians. Let me finish here, and I will leave more room for probably to talk about the mental health response. I hope I didn't take more than the time I should take. Thank you very much for your listening.
Thank you, Samah, so very much. Thank you. You know, I think these meetings, like listening to Samah, and I know the next presenters, just underlines how important it is to have this platform, because otherwise these things we don't hear about, you know. So thank you very much, Samah. Our next speaker is Dr. Yasser Abujana. He is a Palestinian psychiatrist who lives and works in Gaza. Dr. Abujana is a member of the task force which developed the National Mental Health Strategy for 2015 to 2019 in Palestine. And since January 2014, Dr. Abujana is the director of the Director General of the Gaza Community Mental Health Program, which is a leading mental health service provider in Palestine. And Yasser, the floor is yours.
Hello, everyone. Good morning, good afternoon. It's my pleasure really to be with the Jewish Voice for Peace for today's event. And thank you, Lama and Alice and the organizers. I am not sure from where to start, actually. There were a lot of thoughts where to begin with. I am sure that with our participants reaching more than 100 people, I would like to congratulate everyone for the efforts and say that I am sure that most of you know really the case of Palestine in general, and the case of Gaza Strip in specific. For example, we all know that we have almost 70% of the populations are refugees. We know that the Strip itself is under occupation since more than, I don't know how many decades, but it's many decades already. We already know that it's under the blockade since 2007. And during those 3 years of blockade, we were exposed as population to various attacks. We speak about 2008, 9, 2012, and then 2014. And then we speak about what happened during the Great March of Return, where people were, you know, just peacefully demonstrating against the conditions in Gaza Strip that was met by excessive power, leading to more than 30,000 casualties. So we ran from one difficult condition to the other difficult condition. And we rely a lot on what many people say resilience or name resilience. And then we can dream, we can inspire, we can hypothesize, we can anticipate, we can, think together about what does that resilience mean. Well, for a mental health professional, of course, I would like to say that what we all the time had in mind that the Palestinian people, what really keeps us alive is like a few very known things to all of us. One of them is that we have a just case. We are people who are looking for our freedom, whether in Gaza Strip or in West Bank, and that the international community, the international conventions all stand beside us, and it's just a matter of time. If we are going to talk what Martin Luther King was talking about, justice, no matter how that curve bends, it ends towards justice, So, so it's a just struggle, and that, like any other people under occupation in the world, we are going to end up winning it with the support of all the people who stand for justice, stand for peace, and stand for freedom of the people. And this is one aspect of it. But the other aspect of it is that we have very strong social, let me say, ties, that we have very strong family structures, that the social network around the Palestinian person, individual, is very strong, whether this is the parents, whether this is the children, whether this is the siblings, whether this is the parents-in-laws, etc., etc., etc. That very strong network was extremely powerful in keeping our people live together, struggle together, and go on with lives. We speak not only about few tens of thousands of people who are struggling. We speak about more than 1 million refugees who are dependent on food aid support in Gaza Strip. We speak about another 80,000 families who are supported by the Ministry of Social Developments. We speak about very big unemployment rate that continue to be, which is now, I think, reaching more than 54% prior to the closures that were due to the COVID-19. And now with the very first natural disaster that I could count, on top of all the things that we are going through, we have the COVID-19. And Allah, finally, we have something good about living in Gaza, which is that no one is really allowed to get into or out of it without certain, let me say, procedures, which meant, you know, what happens. And that somehow kept us away from being really affected as many other places around the world. We live in an island that seems to be out of the planet Earth. You know, to get into, you need very special treatment. To get out of it, you need even more special treatment. And I am sure that many of you know about these things. So this a little bit spared us from the problems that we had or that other people had with the COVID-19. So far, I think we have only 72 positive cases. They were all registered in the quarantine centers. Everyone coming from outside Gaza Strip was put into quarantine center for like 3 weeks until they test negative and then they leave, which is so far the community inside Gaza Strip is almost COVID-19 free, which is good. However, there were many restrictions that were imposed on the people, like many other places, like any other place on the world. Literally, that means social distancing meant in Gaza that those very strong networks, those very strong bonds and ties, family bonds and ties, that were quite supportive to us are weaker and weaker due to the COVID-19 cases. I mean, COVID-19 pandemic. And this is really a very big challenge. And that led to an increase in the level of the anxiety among the people, increased the fear of infection, the other huge anxiety about whether we are going to be able to deal with the difficulties, to deal with the health issues that are going to be raised if we are going to have cases within the community in Gaza Strip. We all know that the health sector is extremely fragile in Palestine at large, and specifically in Gaza Strip due to the imposed blockade siege, and of course due to the fragmentation between the Palestinian Authority and the governing authority in Gaza Strip. And unfortunately, we as population are paying the price. We made a little survey about, actually it was in April, and to our interest, the main concern, like almost 9 out of 10 people, their main concern was that they needed more information really about how to help their children the current stresses that are related to COVID-19. We know that children in Gaza Strip, like many other children around the world, were not allowed to go to the schools, not to go to the kindergartens, and they were not even supposed to or allowed to go onto the streets. We all know the photos or the pictures of children in Gaza Strip who were running in the streets with, we all know those photos. Now, for those children whose only place to breathe or to ventilate was just to go out to the street, that was even not possible. We know about the crowdedness of the camps in Gaza Strip. We know many things. Now, unfortunately, those children had to be locked down into their houses, and the parents had really many questions. What could we do in order to just keep our children life go on, to keep them just go on? Another point which was really interesting is that more than like 78% of the people whom we looked who filled the questionnaire, they were simply saying that we constantly follow the coronavirus pandemic, which means that you were like extremely anxious, that they want to know what's going to happen today, what's going to happen tomorrow, is it going to affect Gaza Strip? This huge fear of the future that things could really get worse of the current conditions. Now, the other thing, which is more or less good news, is that like almost 56% know where to reach mental health services, where we can find good mental health service. But at the same time, 44% actually didn't know where to reach, which is again another question. So generally, the question was, well, we need some help, some support. And then I'll say one more thing about that survey, which was really interesting, that the marginalized groups of people were more affected. Marginalized, when we speak in Gaza, we speak about victims who were injured during the Great March of Return, and we speak about cancer patients. These two groups of people who are expected to get part of their treatment or all of their treatment outside Gaza Strip is not anymore allowed to leave Gaza Strip for treatment. Usually we had, according to WHO statistics, look into the numbers, about 40% only. Usually about 40% do not really get the permit to go to receive treatment for cancer patients, either in the East Jerusalem or in West Bank. Now, this is almost everyone is not allowed to go to. So there were many concerns about those very fragile communities. And then the question about how to help each other as mental health professionals and how to help other people in the front line was always a challenge. Well, I mean, the thing that we were talking about, that this is a very complicated and compound system that we live under, and that there was a question all the time about how to make our voice reaching, the community, the international community, people who are interested really in supporting the Palestinian cause, which is not only supporting Palestinians because they are Palestinians, but because people are supporting justice, they are supporting freedom, they are supporting the moral challenges that they should stand for. And from there, we thought of the idea of the Palestine Global Mental Health Network, through which I have another two colleagues who are joining us, but I am sure that I'll leave more of that to speak for my colleague Manal. So with that, I'll stop and I'll hopefully leave some time for questions and answers. Thank you very much.
Thank you, Yasser, so much, and for making it with everything going on. And thank you. There was, I don't know if I'm being too positive, but such a glimmer of hope of the way our sumud, how we persevere and persist. So our next speaker is Manal Abu Haq, who is a clinical social worker and psychoanalytic psychotherapist working with children, adolescents, and adults in her private practice clinic in Ramle, historic Palestine. She's an active member of Psychoactive, which is a mental health professional organization for human rights and against the occupation. She was on the steering committee of the program for politically sensitive psychotherapy and the Child Detainee Evaluation Project, and is a member of the Child Arrest Project. She is an active and important member, like everyone here, of the steering committee of the Palestine Global Mental Health Network. And Manal, the floor.
Thank you, Lama. Thank you, everyone, for inviting us and give us this opportunity. As we are now celebrating the first anniversary of the announcement of Palestine Global Mental Health Network, I will talk about the process of establishing our network and the rationale which led us to do so. The close connections between the members of the Global Network's steering committee were developed and solidified as we jointly protested an international psychoanalytic conference scheduled to take place in Israel. Although our protest actions did not result in the cancellation of the conference, the protest had a powerful impact of the kind we had not experienced previously. For most of us, this was the first time that we acted as an all-Palestinian political group of mental health professionals. In the past, we tended to protest as individuals. This time, We felt a sense of potency and success. We felt also that we had succeeded in making our unique voice heard in a coherent and consistent manner. This sense of success made us want to continue to work together as a group. For me, this was my first opportunity ever to be part of an all-Palestinian group. Despite the geographic distances and the checkpoints separating us, as well as the many other kinds of differences between us, such as the disciplinary differences, we were able to work cooperatively on productive actions. The most important of this action was, in my mind, the founding of the Palestine Global Mental Health Network. The network aspires to advance Palestinian mental health and to be a home to Palestinian professionals everywhere in the world. We extend an invitation to Palestinian colleagues to express themselves by becoming active with us on matters of Palestinian mental health and to receive support and enrichment. The continuous occupation and Nakba have engendered numerous splits within his geographical splits, intrapsychic splits, and social splits. We are interested in challenging the splits dictated by the occupation and to work on building social and mental links for the sake of the mental health of our communities. Working together as a group under the conditions that we are faced with is in itself an accomplishment. Suspicions abound, and so does competitiveness, because our resources have been limited. We Palestinians have learned to compete with one another. Under these conditions, establishing a communal space that can contain multiple voices is premised on the belief in the importance and potential effectiveness of the particularly Palestinian contribution. In a complex challenge, one that required ongoing work on the mutual trust within the group. The decision-making processes of the network steering committee have been notoriously slow. We believe in the importance of hearing all the different voices before we decide. Voices come from different geographical locations and different political realities, voices of political subjects with different degrees of access to civil rights. Our discussion raised our awareness of the complexities of the political situation, and we take precautions when contemplating protest action or formulating position statements so as to avoid causing harm to any of the subgroups that the steering committee members represent. We strive to avoid splitting and to foster an inclusive and containing space for all Palestinian mental health professionals, one where minority opinions are not automatically perceived as treason. The network produces knowledge to the convergences between the political, the ethical, the psychological, and the human rights realm. This knowledge is based on our experience providing psychotherapy within the Palestinian context. In addition, we blow whistles in response to actions and situations that threaten collective Palestinian mental health. So far, this has been done by means of position statements. The network is committed to the values of freedom, justice, dignity, and equality for all human beings, and sees this as necessary for mental health. We call upon international professional organizations and individual professionals who share these values to join us in solidarity when we protest violations of these principles. we do not view ourselves as inferior or weak, and invite solidarity that is based on shared values rather than on sympathy or concern. I can stop here, and I can talk about one of our projects that we one of our projects in the network that
I think yes, do Manal. I
yes,
think the peer supervision.
Okay,
yeah. I think it's important. Yeah.
Okay. Over the recent months, we, like others on this planet, have had to deal with the crisis induced by coronavirus. As mental health professionals, we face the calamity of an unfamiliar shape and an unpredicted scope, with no relevant tool sets and with no ability to foresee what the future might have in store. How are we in the midst of our own overwhelm to fulfill our mission as Palestinian mental health professionals? How are we to assist our people in processing the anxieties and horror that the illness and the economic of political crisis accompanying it evoke? And in coping realistically, adaptively, and self-protectively with this crisis. We at the Palestinian Global Mental Health Network saw ourselves as obligated to take an active role in helping each other face the formidable challenges of this time period through mutual support and peer supervision. So we proposed to establish collegial peer supervision groups. The groups meet remotely on Zoom. We envisioned groups where all participants would have an equal status that would aid the members by providing needs, consultation, and mutual support. Peer supervision groups are less likely to reenact power hierarchy that characterize groups led by supervisors. The idea was to empower all groups members by creating a situation where we could feel that we could contribute and meet each other's needs. The group in which I am participating had begun meeting in March. The participants who arrived from different geographical locations, West Bank, Gaza, Israel, and US, are active and committed to the group meetings. Beyond the need to consult on matters related to coping with the pandemic, participants are having a powerful emotional experience connecting to fellow Palestinians in various parts of historical Palestine and the diaspora connection that have been severed by the Nakba. I observed mutual curiosity about the different socio-political realities with which participants in different locales are coping and striving for connection and for rebuilding severe ties. Feelings of love, grief, pain, guilt, and compassion are expressed frequently in the group. Thank you.
Manal, this is brilliant. Thank you so much. I think we have a troll or something. I hear echo. Or is it me? No, it's fine now. Okay. Manal, this is really amazing. This is really brilliant. You know, I was thinking as Manal was talking, and I'll wait for questions so far. Oh, there, some questions are coming. But let me say very quickly is, you know, one of the members of the network, Renan Shishibi, said once, the way the occupation works is it really tries to destroy your secondary process thinking. You know, that's how they destroy, try to really oppress you on every level. And I think that's the peer supervision groups have really helped in that. And Zoom, I think maybe Zoom should get a Nobel Prize or something. although I really don't like Zoom, but really it has helped so many people. And in Palestine, you can overcome walls, checkpoints, borders, visas, everything, and we can be together. And this has been amazing. Anyway, let me ask here, there's a question from Maxine, and it says, Dr. Yasser, can you talk about the implication of school closure due to COVID-19 for the children in Gaza? It seems it's a big loss of not just education time, but also mental health support services. Are you seeing, well, maybe I'll leave that part of the question. The question is longer. If you want to talk about this, Yasser.
Yep. Thank you very much, Maxine. Maxine is one of the friends of GCMHP, like many of the people who are around here. Thank you for being there. One thing is for sure is that throughout the pandemic, since it began until now, the GCMHP activities or Gaza Community Mental Health Program are still the same. We are continuously providing the same services. On the contrary, we even increased some of the services, which are basically awareness raising activities, especially through various media outlets, and in the same time increasing the work of our toll-free line. Well, we have a toll-free line, which is 1-800-222-333, through which people can call and speak about their difficulties in case they are not sure that our community centers are operating or they have problems with accessibility. Now, many of the people who were calling, or many of the people who were raising issues or who were surveyed, were talking about difficulties with children. Now, if you speak about the weakest point in the Palestinian cycle, like in the family, it's usually the child, unfortunately. And when we see a child who come to our community centers and who meet the therapist, complain of something, usually there is something that is not right within the family structure itself. It could be with the father, it could be with the mother, it could be a traumatized child, etc., etc., etc. Now, with the case of we already know that a lot of the Palestinian children in Gaza Strip have problems that are related to the traumatic events. We speak about 3 or 4 major issues. One of them is bedwetting. The second one is various problems with irritability, with sleep difficulties. And then you have basically low school achievement, and then you have some bullying among children, because children are really irritable, they are afraid, they are not sure how the night will go, they hear bombardments during the night, they hear the drones all the time. They live with what we call the cues of the traumatic events that happen every now and then. We always say that any 15 or 16-year-old child was exposed to 3 traumatic events through his life, one of them continuously for 51 days. Now, those children keep showing some symptoms every now and then, and they need space to ventilate, they need space to empty their cups, they need some room to move around, to play like many other children. Now, a lot of that was really lost due to the closures of the schools and due to the obligations to stay at home as much as possible. And that led children to basically to confront their parents with the difficulties, with the issues that they face. In Palestine in general, in Gaza in specific, almost everyone knows that children go in 2 different shifts to the school. Some of the children will go in the morning shift, some of the children will go in the afternoon shift. So strangely, this is the first time, like 3 months period, for the whole period of the life of many of the children, that the whole children of the same family are staying together the whole day. And this all is adding a lot of pressure on the shoulders of the mothers especially, and then on the fathers who are also sitting home for difficult reasons. Now, this kind of are irritable, others are concerned about the futures, others are irritable, mothers are finding difficulties with things. This kind of very difficult interaction might lead to a lot of difficult issues. First, the thought of controlling the children, how we could deal with the anxieties of the children, how we could deal with the children who are disobedient, they begin to become disobedient, etc., etc., etc. And one of the things that we thought that this would be an excellent solution was that we have we have now each Thursday at about 1 p.m. Gaza time, we have one Facebook online, let me say, I wouldn't say lecture, but an awareness session through which one of our psychologists or children therapists will talk for about 15 to 20 to 30 minutes, and later he will try or she will try to answer questions. During the last like 4 or 5 weeks, the main focus was either was all the time family. Sometimes the focus was how to try to avoid clashes within the family. We speak about a very expected and reports of increased violence against women in Gaza Strip. We also hear about children who are like abused one way or the other, maybe verbally, maybe psychologically. And the question was always how to respond to that. And that's why we try to tackle that issue. Another way of tackling it was through radio and TV programs. And then you have to give brochures and leaflets to everyone in the community. And finally, we also encouraged school counselors to try to reach their children, I mean the school children. And we had a couple of online meetings with school counselors trying to help them deal with the difficulties that come to their attention through children. Now they say that we are going to get back to schools in August. Hopefully that will happen. I'm not sure 100%, but we have a big program with some schools on how to support the children within the schools and within their families, and hopefully we'll be able to provide more direct support. So this is in general. It's a huge matter. A year ago, the national level, I don't remember if it's UNICEF or WHO, they said that 1 in 4 children are still in need for some sort of psychosocial support, which is more than 240,000 children in Gaza Strip. So on top of that, we live the current conditions. On top of that, our services are more needed than ever. On top of that, we are limited with resources. We are a non-governmental organization, but we try to reach as many people as possible. And the best way to do that is to educate the whole community, if you can do that. Thank you.
Thank you very much, Yasser. In fact, I mean, I didn't know about the Facebook. It's great. Several questions were asked. I haven't finished all your questions, Maxine, but several questions were asked about group support among parents or Zoom meetings. And Samah, I don't know if you have something to add there. We can't hear you. You're muted, Samah. Oh, there you are. Okay.
Yeah, I think there was a question about group therapy for children. We have a very developed action plan for mental health response, a national mental health response arranged by the Ministry of Health, Mental Health Unit, and other stakeholders in the field of mental health in the West Bank mainly, but we also try to coordinate with our colleagues in Gaza via Zoom, working around all the splits. And this plan is composed mainly of certain measures to avoid the collapse of our service to mental health patients who already receive service from community mental health centers and psychiatric hospital. And it also tries to meet the needs of new people who are affected by this crisis. We observe already that health anxiety, OCD, common mental disorders, stress is increasing. Unfortunately, the preparation for the health response required the closure of the establishment for drug addicts, which makes them even more marginalized. So we are trying to create an alternative plan to meet their needs. If you wish to read more about this plan, I already published something in This Week in Palestine, and I send you the link.
Thank you, Samah, very much. Thank you very much for that. A question, probably Manal, I'm sure, and you know, the three of you can answer it, but I want to pose it to Manal because I know Manal participated in several workshops on the topic. And one question was whether the COVID-19 had an impact where you see, you know, the mental health issues that came up in the population that are specifically related to COVID-19? Did you see specific mental health issues come up that are as a consequence of the pandemic and the lockdown, Manal?
I think there's I think that the main thing that we gain from that the legitimacy of meeting in Zoom, that we are not feel as Palestinians as irregular. Other things I didn't prepare myself for this question. I'm sorry.
Well, I'll tell you why I thought about Manal for this question, because she held one interview on Facebook where she, you know, one of the issues that came up, which actually came up in many places, how do we manage these kids in a small place where we're working from home? You know, this was one issue that came up. I remember you talked about that, Manal. But probably we could move to the next questions. And let me see, I lost track of the list here, but I'll tell you what I remember. An important question came up, which is, what could we, you know, Palestinians and non-Palestinians who live outside can do to help you that goes beyond participating in very important places like Jewish Voice for Peace and other places? How can be of use to the Palestinians? Probably this could go to any of you. The question can go to any of you. Samah, yes, please.
It's a big question. I will try to give a small answer for this question. If you're in the United States, try to learn about solidarity groups that support Palestine. If you're in the field of mental health, check USA Palestine Mental Health Network. Try to support them. If you're outside these groups, make sure not to engage in programs that normalize the occupation of Palestine. Avoid normalizing relationships, and check BDS if you want. There is more to do, but at least these are pragmatic suggestions.
Thank you, Samah, very much. So let's see, we have 6 more minutes, so we could take a couple more questions. Let me see. So someone is asking, okay, these questions are going out too fast. As mental health professionals, as I am, how do you deal with the emotional trauma that must come after incidents like the murder at the checkpoint of a young man on his way to pick up his sister by IDF soldiers? And not only do we, Palestinian mental health professionals deal with trauma with their clients, we deal with it personally too. Samah, go ahead. Yes, Samah.
I think this question is difficult already, because the assumption is that there is this very well dissected trauma and we need to deal with it. But when something like that happens, the impact is collective. And there is also a direct impact on those who watch it, who see it, or family members, people who are in the same circles of grief. But it also provokes historical traumas, because we are talking about an enduring occupation over so many years. And we are talking about generations of traumatized people. This person must be coming from a family where the parents were exposed to land confiscation, home demolition, other deaths due to political violence. It's really difficult to ask this question and come up with a technique that will work. We are familiar in Palestine, mental health professionals are familiar with interventions, evidence-based interventions that can be helpful in trauma, like trauma-focused CBT, narrative therapy, or you name it. But I don't think that this works in Palestine, because basically all these evidence-based interventions, they depend on establishing a safe place, and then reworking the event, exposure by narrative, by whatever. And I think the big failure is that we cannot establish the safe place. People who come to see us because of trauma, they are so worried about future consequences of the thing that they happened, especially when we talk about imprisonment. It's very likely, I work with many people who came to be treated from symptoms due to the trauma of imprisonment, and while in treatment, they were rearrested and imprisoned again. So I don't have an answer for you. I just wanted to elaborate on the complications of working in cases like that. And I think it is this kind of clinical experience that makes us see that the advocacy of Palestinian rights and the solidarity with the Palestinian people is an imperative, is a professional imperative.
Thank you very much, Samah. So let me see. Sam, I don't know how to go up in the questions, but we do have 2 minutes left.
You should be able to scroll up if you have.
It keeps talking. Like, anyway, I'm kind of stuck in here.
I'm scrolling up to see there's a question: what percentage of Gazans have access to the internet, and what is the effect of intermittent electricity access?
I think Yasser left. I don't know, Samah, do you know anything about that? Yeah.
The question is about electricity in Gaza, or?
Electricity
and internet, and the effect of that level of access.
In many places, internet is not available. In the West Bank, for example, the Bedouin community is a high-risk community. Some surveys shows that their well-being is impaired in comparison to other parts, to other population in the West Bank. But during this crisis, these people, many of them, they don't have internet. Most of them, they don't have internet in their neighborhood. And in some neighborhoods, they lack electricity. They will be even more, their situation will be even more at jeopardy if the annexation takes place. They will be more affected because they live in Area C where the annexation will take place. And I'm sure in Gaza, there are certain places where there is no internet and electricity. I don't know if Yasser is still here to answer this question. I don't know the percentage. It's better than last year and 2 years ago, but still there is an important deficiency.
Yasser is back. Maybe Yasser could add something. We have like 1 minute left. Yasser? Well, maybe that partly answers your question about, oh, he's back. Yasser, we can't hear you.
Yeah, sorry.
Oh, there he is, no problem.
Of unmuting myself. Two basic things. One thing is that the usual now practice of our power is 8 hours on and 8 hours off. So there might be a problem with internet because we don't have electricity. This is one issue. The other issue is the cost of the internet. Currently, many people, they have really problems with finding means to just pay 1 shekel for upload, which is like $0.25 to give to their children per day or even per week. You know, so the cost of the internet is an issue. However, I think internet is very good to be used, but again, you cannot make sure that everyone who is in need for it is capable of seeing what you are doing at the same time, unfortunately. And the electricity got disconnected, but I had like to stay away like for 2 hours until the router keeps running again. So sorry for being away.
Thank you very much, Yasser. And I think that is kind of where our time is up. Yasser, Samah, and Manal, thank you so much for this really informative and enlightening meeting. And thanks to JVP and everyone.
And it was a pleasure to work with you.
Thanks to you.
Thank you. And I don't know if Alice is there.
I'm here.
Yeah, okay, there you go, Alice.
No, I just think it was just a wonderful collaboration that we could share our mutual interests and that you could help organize these wonderful speakers who we know, but it's just a whole different situation when they share their experiences and their thoughts on mental health, and we really appreciate all the work that you're doing. So thank you so much.
Thank you.
Thank you very much.
Alice. Okay.
Thank you.
Bye-bye, everyone.
Bye.
Wash your
Goodbye.
hands. Don't forget to wash your hands. Bye.